It's a great honor for me to be here at the Empire Club of Canada today, which is arguably the most famous and historically relevant speakers podium to have ever existed in Canada. It has offered its podium to such international luminaries as Winston Churchill, Ronald Reagan, Audrey Hepburn, the Dalai Lama, Indira Gandhi, and closer to home, from Pierre Trudeau to Justin Trudeau. Literally generations of our great nation's leaders, alongside with those of the world's top international diplomats, heads of state, and business and thought leaders.
It is a real honor and a distinct privilege to be invited to speak to the Empire Club of Canada, which has been welcoming international diplomats, leaders in business and in science and in politics. When they stand at that podium, they speak not only to the entire country, but they can speak to the entire world.
Good afternoon. Fellow directors, past presidents, members, and guests, welcome to the 118th season of the Empire Club of Canada. My name is Sal Ravani, and I'm the first vice president, board of directors, the Empire Club of Canada, and your host for today's virtual event titled Healthcare Delivery to Ontario's Northern Remote Indigenous Communities during the COVID-19 pandemic. I'd like to begin this afternoon with an acknowledgement. I'm hosting this event within the traditional treaty lands of the Mississaugas of Credit and the homelands of the Anishinaabe, the Haudenosaunee, and the Wendat peoples. We encourage everyone tuning in today to learn more about the traditional territory on which you work and live. The Empire Club of Canada is a not-for-profit organization, so I now want to take a moment to recognize our sponsors who generously support the club and make these events possible, complimentary for our supporters to attend. Thank you to our lead event sponsors, Billy Bishop Toronto City Airport and Touch Medical. Thank you to today's supporting sponsor, Life Labs. Thank you also to our season sponsors, Bruce Power, Canadian Bankers Association, Liuna, and Waste Connections of Canada. Now, before we get started, a few housekeeping notes. I wanted to remind everyone participating today that this is an interactive event. Those attending live are encouraged to engage by taking advantage of the question box by scrolling down below your on-screen video player. We've reserved some time for audience questions at the end of the discussion. We also invite you to share your thoughts on social media using the hashtags displayed on the screen throughout the event. If you require technical assistance, please start a conversation with our team using the chat button on the right-hand side of your screen. To those watching on demand later, and to those tuning in on the podcast, welcome. It is now my honor to welcome our guests today to the Empire Club of Canada's virtual stage for the first time. They include Dr. Isaac Wagosh, Alvin Fiddler, Dr. Homer Tien, and Willow Fiddler. You'll hear more about them shortly. You can find their full bios on the page below videos player on your screen. Before we hear from the panel, I'd like to invite Carrie Bois, CEO, Touch Medical, to deliver some opening remarks and introduce our guests. Welcome, Carrie, and over to you.
Thank you, Sal. I would like to thank the Empire Club of Canada for providing Touch Medical with the opportunity to sponsor this event. I'm Carrie Bois, CEO of Touch Medical, and I started my career in healthcare in Northern Ontario and had the opportunity to pivot into the tech sector. I've also been pretty passionate about helping startups in Canada. Growing up in an underserviced medical community, I am particularly drawn to today's topic. The COVID pandemic has highlighted and exploited many of our disparities in certain communities, especially northern remote Indigenous communities. One of our co-founders, Josh, actually has a family member who's teaching at Cape Dorset, located at the southern tip of Baffin Island, where there was a real connection to the challenges and resiliency during COVID. At the heart of Touch Medical is the overall desire to develop technology that leverages AI and focuses on the healthcare sector that we feel has been underserviced in this area. We developed a consumer-based solution that is beta testing right now that would bridge the gap of consumers who want to track and monitor their health or those who do not have access to healthcare. One of the projects that we are considering of particular interest with our product team is the opportunity to try and solve the long COVID challenge by adapting our solution to track, monitor, and allow consumers to effectively manage and engage with their health teams. Our global team is committed to providing value-added tools That will allow technology to do some of the heavy lifting in the healthcare sector. We are proud to support today's event and look forward to hearing from this power panel on how we can continue to support the efforts to deliver healthcare to northern remote communities. Before I hand over to them to get started, I have the privilege of introducing today's guest speakers. Dr. Isaac Bogosh, infectious disease specialist, University of Toronto and Toronto General Hospital. Grand Chief Alvin Fiddler, health transformation lead and negotiator, Nishnawbe Aski Nation. Dr. Homer Tian, president and CEO of Orange. And our moderator today, Willow Fiddler, staff reporter, the Globe and Mail. And now, handing it over to Willow to get us started. Willow, it's all yours.
Thank you, Miigwech, Carrie, and Sal for those introductions. I'm coming from you today from traditional Treaty 3 territory, and I'm really excited to be a part of this panel discussion. As a reporter who's covered COVID in First Nations and as a member of a remote community in Nishnawbe Aski Nation, I think there's so much that the rest of the province and country can learn from how communities have had to protect themselves in the face of so many systemic challenges. So let's get started right away. Alvin, we're going to start with you. And I should actually I just want to quickly clarify. I know Alvin was introduced as Grand Chief of Nishnawbe Aski Nation. He technically is no longer Grand Chief of Nishnawbe Aski Nation. He previously was. He's now the lead for the health transformation for Nishnawbe Aski Nation, another very, very important role that he's taken on since he stepped down from the Grand Chief position. So he's still his experience comes from his terms as Grand Chief of Nishnawbe Aski Nation. So very excited to have him here. Alvin, if you can take us, please, to Northern Ontario, Northwestern Ontario, and briefly describe the state of healthcare and services in Nishnawbe Aski Nation. Geographically, it's the largest region of Ontario. It's as big as France and home to close to 50 First Nations, many of them mostly remote and isolated. So if we can just start with, what did healthcare look like in NAN pre-pandemic? Sorry, Alvin, you're on mute.
Miigwech, Willow, and Miigwech, Sal and Carrie for the introduction and for inviting us to be a part of this, what I consider a very important conversation, talking about our communities, especially in the far north. And we tend to forget those communities that are not within the vicinity of the center of the universe, Toronto. So thank you for inviting us to talk about our communities and our challenges and our successes. Just going back to Willow's question, I think it's important for those in the audience to continue to educate themselves about Indigenous issues generally. I know over the last year or so, with the discovery of children's graves across the country and the former residential school sites, that it's shining a light on the colonial history of this country, and it's no different in healthcare. The fact that we are governed differently under the Indian Act and the Indian Health Policy, it's always been a two-tiered system, and we even had Indian hospitals. I was born in one of them in Solihull many years ago, and we all know that that system that was designed for Indigenous people is far inferior. And when the pandemic hit, those gaps that were there just became more and more pronounced the deeper we went into the pandemic. And that's the work we've been doing over the last 2 years plus during this pandemic, is to not only bridge those gaps, but to build new systems that weren't there before, public health, for example, or mental health. So it's forced us, and not just NAN, but Ontario and Canada, our government partners, to collaborate, to work together, and then protecting our loved ones, our elders, our children, our kids from COVID-19, and just making sure that we have a good pathway moving forward as we move into the post-pandemic world.
Can you just share a little bit about, I recall early on in the pandemic, there was an immediate sense of urgency for the remote First Nations because of the current state of healthcare, or lack of, I should say. Can you maybe just talk a little bit about a couple of, what were the higher risks for remote Indigenous communities that really compelled that sense of urgency?
Yeah, I think NAN was fairly quick to act. With the threat of COVID, even back in January 2020, we knew something bad was coming to our territory, to our communities, and we started writing letters to our leadership to sort of get ready to try to prepare themselves for this virus that we heard about. That was in overseas and it was coming. And just try to put together their own pandemic plans, their own teams, and we were very fortunate that we were able to put together, day 3 of the pandemic, our own pandemic response team, made up of knowledge keepers, elders, traditional healers, experts that came together very quickly to help support our communities and just making sure that whatever the communities needed to protect themselves, that they had access to those resources that were so critical, especially in the early days of the pandemic.
Dr. Bogosh and Tien, I'll open it up to you if you want to add anything. You both have been involved in the delivery of services required for the First Nations in NAN. What did you guys learn about the state of healthcare in remote Northern Ontario?
I'll jump in real quick. So for starters, thanks, Willow, for that question. And obviously, it's an extremely important point because, just calling it how it is, I'm literally sitting on the 14th floor of the Toronto General Hospital, in downtown Toronto. And it's not fair to say that, hundreds and hundreds of miles away, we should have any, meaningful thoughts about how things should run in Northern Ontario. The key here is to really listen to local communities and local leadership to really have a better assessment of what the healthcare capacity is, what the healthcare needs are, what the needs of the community are, the perception of the community. And, I think perhaps throughout this chat we're having, you're going to see a recurring theme, and that's listen to local leadership, listen to local communities, and work together with local leadership. And that's exactly what we did. I mean, I was heavily involved in the vaccination campaign, for example, here in Ontario. And, my role was really to listen to what local leaders had to say about what their community needs were, what were their perceptions, what were their questions, what did they want to know about the vaccines, for example. And we just spent, endless hours on Zoom and Skype and group chats, just listening to what their questions were and listening to what the local needs were. And they were great. And it's not to say that they were the same. They were actually different than some of the needs and perceptions and issues that we would have in, for example, Southern Ontario. So lots of listening, lots of learning, two-way flow of information, and really leaning heavily on, Alvin Fiddler and his team and the local leaders in Northern Ontario and the Indigenous communities.
I'll just jump in as well, and thanks, Willow. I think what Alvin said and what Isaac said in terms of some of the infrastructure problems, the human health resources, and really, I think when we talk about Northern Ontario, I think we have a sense for those of us who live in Toronto to think of Northern Ontario as anything north of Steeles, but I think the geography that we're talking about here is, to give it a perspective, say from our major air base in Northwest Ontario in Thunder Bay, it might be 900 kilometers one way
to the northernmost NAN community of Fort Severn. And so when you think that, in the setting of lack of human health resources, lack of infrastructure, and then you add in the effect of long distances and weather, poor weather reporting, and poor de-icing facilities in the north, I think there's a combination of things that make it very difficult for people to access healthcare.
Alvin, health transformation in NAN started before the pandemic. Can you briefly describe what health transformation is, and what did that look like during the pandemic? Because we've seen it in action. If you can tell us about that.
Well, we back in 2015, when I started my first term as Grand Chief of NAN, the chiefs, the communities of the Steinbasket Nation mandated us, gave us direction to declare a state of emergency on health and public health because of just how deplorable the situation was on the ground. And we made that declaration shortly after that. And we came together, the province, the provincial government. At the time, it was the Liberal government. Eric Hoskins was the minister. Federal government was represented by Minister Jane Philpott. And we met here in Toronto, actually. And we agreed on a set of principles in terms of what we should do what we can do to begin to transform healthcare for our communities. We signed that agreement. In some ways, it's groundbreaking when I look back now on what the agreement says. So we began that work in 2019. We had to build our team and then some initial community visits, and then the pandemic hits, 2020 spring, and we had to keep moving forward. Like, we couldn't use this pandemic as an excuse not to just to stop and sit at home in our basements. We actually had to put health transformation into action, and we saw that on the ground at the community level with our leadership, with chiefs making their declarations on lockdowns, passing their own laws and BCRs, Band Council resolutions, and just transforming public health and really being forced to build systems that weren't there before, like public health, mental health, and non-hope. Like, just the incredible response that we saw across the NAN territory from our leadership is, I think, to me, it shows why health transformation is the way forward, why we need to, even as this pandemic hopefully goes away, that we need to keep on that path, and we need to build on the work that our communities in both Ontario and Canada have done over the last 2 years or so with the COVID response, and just keep building on that path.
Thank you. Homer, I'm going to move on to you. You helped lead the successful task of vaccinating thousands of people in NAN as part of Operation Remote Immunity. What were some of the challenges that you encountered, and what was the response plan or strategy required to pull that off?
Yeah, thanks, Willow. I think we've already talked a bit about geography and weather. Those are sort of ever-present factors in the north. There was a huge time pressure, and I think Alvin would remember this as well. Basically, I think both NAN and Orange were asked to co-lead this and co-develop this in late December 2020. The vaccine had just arrived, and one of the principles was we didn't want to bring COVID into the communities, and everyone had to be doubly vaccinated. We had to find people to go there, and we had to finish by early April because of the risk of spring flooding and because of the risk of evacuations for forest fires of the communities that would spread people all over the north. And so there really was a sense of we don't have a lot of time, but these are really just operational challenges and solvable. I think, I think if you asked any of this group, the really big challenge was from a vaccine confidence, a deep-seated mistrust of government and outside agencies. And I think you could say that this is really, generations of colonialism, systemic racism, residential schools, and broken promises. And so this really resulted in a suspicion of the vaccine program, and the entire health system by the community members. And the solution is simple yet extremely complicated. The solution in a word might be trust, build trust, but boy, that's a hard thing to do. And luckily, Alvin was there, former Grand Chief Fiddler was there, really step by step helping with this. And I think it's concepts of Indigenous leadership and autonomy that are simple words, but really putting those into effect. And so we had Indigenous leaders fully involved in the development of the plan and implementation at all levels. And I think the community members needed to see that their leaders were confident in the plan. So they were all involved in the development. They saw the leaders getting the first shots in each of the communities. I think this group, former Grand Chief Fiddler, Isaac, and I, we were on multiple calls asking over Christmas and in January, answering questions about the vaccine program. And I think for trust, the last thing I'll say is you have to do what you say you're going to do. So if you're going to say something, be thoughtful about it and make sure you do it. And one of the things I remember that Nan had asked for and we promised to do was translated consent forms. And let me tell you, it's a lot harder than I might have thought to get translated consent forms in Cree, Ojibwe, and Oji Cree and have them approved by vetted translators. And but luckily the Ministries of Health and Indigenous Affairs were super motivated, worked extremely hard, got them done for us. And it's important to do these things to show that we mean what we say and that we respect the culture and Indigenous leadership and autonomy.
Thank you. A lot of really great points there, Homer. Isaac, you put your thumbs up there when he started talking about the mistrust and the hard work involved to change that. You've had some experience with patients where you work. Patients who've had to come down to the Toronto hospital. Can you explain what are some of the things that you've learned throughout the pandemic about health transformation and the needs in the North?
Right. I mean, thanks, Willow. That's a great point, and I appreciate you bringing it up. I mean, long before the pandemic, we know, sadly, there's just limited healthcare capacity in many of the remote and Indigenous communities, and oftentimes if people are sick enough, they're transferred to other places in the province and some of the larger hospitals and bigger centers. I'm at Toronto General Hospital. This place is no different. We'll often see patients transferred from Indigenous communities who require hospital level care and the care that can't be provided locally. And again, always happy to help, always happy to see. And I know there's a relationship and arrangements, but just calling it how it is, it's always best to care for people at or near their home where they're comfortable, where they have the support system, where they have the support network. And sometimes, even again, this predates the pandemic, when we see people who have been flown out for, procedure A or procedure B at our hospital, they don't have their family or their community support network. And that just poses additional challenges to care. Often the medicine's not that hard, right? We know what the issue is. We know how to help out. We know how to, get to the bottom of it. But you really do, it just exemplifies how much of a social support network and a community support network it really goes into the healing and recovery of individuals. And as you point out, the trust is so crucial. I mean, we have these conversations with people. And again, as a physician, you just want to do your best to help the patient out. But sometimes we have these conversations with patients, and you can tell there is that mistrust. There is that sense of, are we actually on different teams? And, we do our best in an imperfect situation. Call family, call friends, call community members to get on the phone with the individuals. Sometimes we even have other community members as an ally who is in the hospital with the patient. But it's challenging, and we always try our best. But of course, there are significant challenges. I'll stop blabbing. But one other point: during the pandemic, of course, we saw this exemplified, and as Alvin and Homer will point out, when we were discussing vaccinations or treatments, the whole goal was to do everything we could to provide the best care possible, support local communities with knowledge and with information and with technology and with medication and of course with vaccines, to really ensure that people had the best possible care at home so that they wouldn't need to be transferred. And that's a laudable goal. Now, last point, and then I really will stop. Obviously, there's a long way to go. And, I'll lean heavily on Alvin to go into what those details are, but really there's a long way to go in terms of improving trust, improving support, and, both training of individuals and personnel, plus actual hardware and actual infrastructure to provide better medical care and psychosocial care in Northern Ontario communities.
Thank you, Isaac. I just want to remind the audience, please submit any questions you may have for any of these gentlemen here. We will take some time in a bit to get into some questions, but we'll keep this discussion going. So there is a consensus here that healthcare really can't return to status quo. As Alvin mentioned, as we hopefully now begin to move out of this pandemic, and that there really is an opportunity here that shouldn't and can't be overlooked. Alvin, what's next for health transformation?
Well, just to keep building on the work we've done, and I'll keep repeating that message to both Ontario and Canada. I want them to not forget the important work that they were a part of. And it was extraordinary to witness, just how quickly we can move on issues that traditionally it would take us a year or 2 years. We were able to put in place those things like in a week or 2 weeks, cutting the red tape, bypassing, certain processes, and just moving quickly, knowing that there was a huge sense of urgency on the ground, that we could not do things the way we used to do them before. We created a trilateral table, for example, where we had senior officials from NAN, from our communities, from Ontario, from Canada, that convened once a week. And they would talk about the urgent needs of our communities and just making sure that things happened right after the meeting. There was an accountability table that we built to make sure that things that we talked about were actually followed up on. And to me, I think that's a great roadmap for all of us. That, my fear is that Canada, or the federal government of Ontario, will start going back to the way things were, and we cannot afford to go back. And I hope that they, and it's a credit to every one of us that we're a part of this important mission, that we did this together, and the only way we can continue to build on that work and really truly transforming healthcare and then in the north is the continuing with that true collaboration that we witnessed and that we were part of during the pandemic.
Thank you. Homer, what, in your opinion, what will it take to continue health transformation in the north? You're on mute, Homer.
Sorry, 2 years into it and I still haven't figured it out. One of the things that I really enjoyed about Operational Remote Immunity, I think my favorite moment was hearing from some of the community members that they were shocked to learn that their communities were prioritized for the very first time for vaccinations. I think Alvin may have mentioned it to me, and I've heard that from different people, because they would say we're always the last to get something or anything, something that is important, something that other people want. And this is something that, if you remember, in 2020, the end of 2020, beginning of 2021, everyone wanted it. and the Indigenous communities, particularly in the north, were prioritized to get the vaccine. And so I think they were surprised and hopeful that this signaled a change in how we think about things and view things. So I don't know if this is true, but maybe we might have earned a tiny bit of trust with the communities and leadership. I hope that's true. We might have earned a tiny bit of credibility. Again, I don't know if that's true, but I hope that's true. And hopefully we can build on this to work with Indigenous leaders to keep developing solutions that work. We know what these solutions are. So I'm not a high-level policy guy. At Orange is an air ambulance, and we have paramedics and pilots. We put boots on the ground to deliver healthcare. And so we know that there are operational solutions to some of these problems. My background is trauma surgery, so I know that there are best practices for trauma systems and trauma care that we can implement to help improve trauma care in the northern communities. Obviously, we can't just take them and transport them as a whole to these communities, but we have to work with Indigenous leadership. We have to respect the Indigenous autonomy to develop solutions that work for the communities, but we can help provide technical advice and work with the leadership to come up with solutions that work. So I really hope that moving forward with this bit of trust and credibility that we might have built, we can continue to look at discussing solutions that might work and making them work for the communities if the leadership is supportive.
Thank you. Again, a lot of great points in there. You touched on, well, I think you've all touched on partnerships and the need to collaborate. Alvin, can you expand on that just a little bit? What kind of partnerships and collaborations have really worked best in these scenarios?
Well, one of the first things that we acknowledged when we began our health transformation journey 4.5 years ago, was that we are not experts on health or healthcare. So we had to reach out not only to Ontario and Canada, but people like Homer, Orange, the College of Physicians, the nursing community, the medical schools, people that do research in certain areas. So we built, I think we currently have about 15 or close to 15 MOUs or agreements with professional health designation bodies because we knew that we could not do this by ourselves. And I think what the pandemic has shown us is that that's the way we need to go, that we need to work with others. And just, I think one of the greatest lessons for me during the last 2 years or so is just how important, Homer talked about trust, and the relationships, the partnerships, and the communities really stepped up, when they saw that collaboration happen, that they felt safe, they felt comfortable, and they really stepped up to be a part of that work that happened.
Quickly want to touch on, because you both make a good point. Homer, you said, we might have earned some credibility, and there is, I see there's a risk, you kind of one step forward and then 2 steps back. How do we avoid that from happening here? Anybody can chime in here.
Can I start, even though I'm the least qualified person and I really would want to hear what Alvin says, but I just want to say something before the thought leaves my head.
Please do.
I think the key here is sustained pressure, in the sense that we need sustained collaboration, not just sustained goodwill, but meaningful action. Okay, this was through Alvin and Homer. Operation Remote Immunity was one of the biggest glowing successes of the pandemic response. It was, a geographic challenge. There were, historic cultural challenges, to put it politely. Everything was not working in favor of this being successful. And through going through the right process there, in terms of truly listening to the communities, listening to the leadership, providing information and tools that were necessary to get people vaccinated, which would protect the communities. It worked, and it also worked in a very short time frame, right? We can't pretend that, in a few months we can put a Band-Aid over hundreds of years of neglect and abuse. Like, that's not going to happen. And I don't think we should pretend that's going to happen. But if we, these are still meaningful arrows and meaningful, this is a meaningful move in the right direction. And I think it just, like both, everyone on this has suggested before, right? We talk about trust. If you say you're going to do something, do it. If you're, listen to the leadership, work closely with the leadership of the communities. And again, it's not rocket science. Like, it's pretty straightforward, actually. But we actually have to make an ongoing, continual effort to keep this up, and it can expand obviously well beyond vaccine uptake and hopefully into mental health care, other issues unrelated to health as well.
Thank you. Homer or Alvin?
Yeah, maybe I'll add something and then I'll turn it over to Alvin. I think what Isaac said about sustained pressure is important. I think, having a schedule, transformation may have different domains where they want things improved, diabetic care, trauma care, or so forth. And I think, a schedule with an implementation on a tactical level is something that can put sustained pressure on moving the ball forward for health transformation. I think strategically, we need to focus sometimes on personal relationships, which are important. So like Alvin and I have worked very closely together, but I think the relationships transcend the individual. And so I think what NAN is doing in terms of MOUs and arrangements between organizations, and then on a larger extent between nations, with the federal government, with the provincial government, I think these types of things cement the relationships that start the conversation, that build a bit of the trust, and we can keep moving things forward. Obviously, NAN has been doing that all along. I think for organizations like mine, though, we don't want it dependent on personalities, and we want, say, Orange to continue to support the efforts of NAN, because we are a part of healthcare access to NAN's communities. And so I think these things have to transcend personal relationships and trust, and be institutional trust.
Alvin, we're going to get to some questions shortly, but Alvin, you've said we need to build on that work as a country. What can others do to help?
I just wanted to just quickly add on to what both Isaac and Homer have said in terms of our health transformation journey. I think it's important that our government partners understand what that really means. They need to understand when we say health transformation, what that means to us and for us. That it's not about taking over or inheriting a broken system, or taking over programs that are underfunded. It's so much more than that. And I think that's an ongoing conversation that we will have with our government partners, that they need to understand what it is, that we're talking about when we're talking to them about health transformation. So I hope to carry on with those conversations in the weeks and months ahead, because it's important that we begin, or that we really need to demonstrate to our communities that what health transformation looks like on the ground. If we had utilized the old system during this pandemic, if we had utilized the old policies, the old ways of doing things, it would have devastated our communities. It would have killed a lot of our people. That's why it's so important that we stop, and I'm so grateful for us to have this conversation today, because it sort of gives us an opportunity to reflect on the work that's been done, and why it's important that we need to keep moving on this journey.
Thank you. I'm going to get into some questions here. We've got a few. So just going off of that, Alvin, what would you like to see governments commit to in terms of improving First Nation healthcare? These are the questions now, guys.
Well, for sure, there has to be legislation that backs health transformation, and right now there's work that's happening federally. There's discussions about a federal health framework similar to the child welfare legislation we saw, for example, last year or a year and a half ago. That there has to be, as we build a system, it needs to be backed by legislation, and I would hope that the government's commitment to build this legislation is real commitment to that change. That it has to be a truly collaborative process. Even word for word, similar to what we did on policing, for example, with Ontario, to make our police service an essential service. So similarly to healthcare, that's one piece. Legislation I think is important, and we need to be at the table as equal partners.
Homer and Isaac, do either of you want to jump in there?
I don't really have much to add on that one.
Okay.
Yeah,
There's a few questions here that have to do, I think people are curious to hear more about what the communities look like now in terms of infrastructure. Apologies if my connection is cutting out. So there's a question here that what infrastructure exists for ill patients in the north. Are there negative pressure rooms for safety of community and staff, isolation locations? How are they cared for before evacuation? There's another question here. Do all First Nation communities have landing strips for fixed wing aircraft to land, or are helicopters needed in some areas? And then this one I think is related as well. What factors identified Indigenous communities as highest risk in COVID-19 response? That's kind of a jumble, but yeah, I think people are curious
to
hear more about.
I think those are Alvin and Homer questions.
Yeah, no, thank you for the question or questions. And I think it's important for all of us to realize that when we talk about healthcare, it's more than just talking about nurses or doctors. We're talking about the community, the environment where we live, our access, for example, to clean, safe drinking water, and those were in the homes, the overcrowding and the challenges that existed before in our communities in terms of the whole infrastructure of the community's access to power, for example. I think this became more pronounced during the pandemic, and water, for example, just how important. I mean, that was one of the public health messaging in the early days of COVID, is that make sure you have you keep hydrated. You drink lots of water. Well, you couldn't say that to 14 of our communities because they were on boil water advisory, including Musquat Dam. We've been on that list since 2004, or Niskandiga, over 30 years now. So those were the challenges that we had to consider in doing this work, making sure that all our communities had access to clean, safe drinking water, including Sandy Lake, a community that has over 3,000 people there. So these were added challenges that we had to factor into our work. Isolation sites, again, was very important. If there was a positive or a couple of cases in the community, you had to remove them from their homes, and just the difficulty and the challenges to find adequate space for them at the community where they can isolate for 10 days or whatever the protocol was at the time. So those are some of the ongoing challenges that we will still face moving forward, and I would hope that we work with our communities to address these are long-standing issues that need to be addressed.
Homer, I don't know if you want to speak to the airstrips question.
Sure, I can speak a bit about some of the aviation and maybe some of the actual healthcare resources. I think, at a lot of the nursing stations, I think they're filled with extremely motivated and great healthcare practitioners that really offer a lot and care deeply for the communities. I think sometimes they're not as well equipped with the equipment and resources to provide the care. And I think if you can imagine in some of the communities, if you call 911, there is no 911. And so there is no pre-hospital system, so to speak, to get you from where you were injured or where you were sick at home to get to the nursing station or the primary care clinic. And then when say you had a heart attack, there may not be some of the life-threatening clot busting drugs, or if you were bleeding, there may not be blood products. And so it's really through an aircraft that arrives, a fixed-wing aircraft that lands, that brings the care that you normally would expect to see in an emergency department in Toronto. And that would be your first opportunity for, in some of the communities, not all of them, to have some of these therapies initiated. Most of the communities have airstrips. There's a couple that do not and are reliant on a helicopter to have access, particularly if they're on an island. And in the summer, you can access it by boat, in the winter on an ice road. But during the freeze up and breakup of the ice on a river or the surrounding water, they're completely dependent on helicopter for access. And that type of access can be limited because helicopters are very mechanically dependent, and they don't have the same ability to fly in all weather as fixed wing aircraft.
Thank you for that. There's a question here wondering, are there opportunities and the potential for virtual care to be used? A really great question. What does that look like in Northern Ontario? Isaac, please go ahead.
We do it. We already do. It's pretty good. There's obviously room for improvement, but virtual care certainly is being done with some communities. I can attest that, like, I myself have been involved with seeing some patients, and it doesn't necessarily mean you even need a big fancy video camera, and it's always helpful, but sometimes it's even done with a simple telephone call as well. But it is being done formally and informally. There is certainly room to expand it, and of course, this is really helpful because now geography doesn't matter nearly as much. And you can access the sub specialist that's, in a major urban center hospital and help at least provide care. I would say, again, I'd be very curious to hear what others on the chat, and of course everyone in the audience has to think. But like, virtual care is helpful, upward inflection ? But it's by no means the same quality of care. And there's truly is no substitute for seeing someone face to face for obviously certain medical conditions. For some things, it's okay. A quick checkup, discussion of some blood work and some updates, but really face to face care and in-person care reigns supreme the vast majority of the time.
Yeah, I would add that one of the exciting projects that I think it's exciting. One of the health authorities that is pursuing right now is this idea of hospital without walls or hospital without borders in one of our communities, one of our bigger communities, and just the possibilities of that. I think, just, especially now with the technology, I think there's so much potential there. And I think there was a question earlier from one of the audience members about how can we, the members of this club or the members that are on this call, for example, how they can be a part of this work. Sometimes I read about, this foundation making a big donation at the Cancer Center in Toronto or the Peter Monk Center. You know what I mean? It's just, there's no reason why you can, also, that you can also make donations to our communities. Is what I'm trying to say. As we build these projects, that there'll be opportunities for private foundations or individuals to support us with some of these exciting projects that we will be undertaking moving forward. So this idea of a remote hospital in one of our communities is something that I think has real possibilities.
I think there's a saying, is it put your money where your mouth is? Maybe that came to mind there.
That's right. That's right. You said it.
A couple more questions. Here's an interesting one. Maybe Alvin, you can talk to this. Wondering how health transformation takes into account Indigenous knowledge and incorporating Indigenous knowledge into healthcare processes, which is key to building trust.
Yeah, I mean, that's very important. And you know, at the beginning of this broadcast or this meeting, I talked about the missing children, the remains that are being discovered across this country, and you know, I think there's an opportunity for this country, for the federal government and other jurisdictions to really be a part of the reconciliation that needs to happen, the journey that all of us need to be on, if we're going to be, just to move beyond the messy, the trauma that we always find ourselves in, the crisis that we're always in, because it is tiring, it's exhausting, and we need to find a path that will allow us to move beyond that. And I would just encourage our government partners, including the federal government, that it has to be a respectful process, whether you're talking about creating legislation or just working with us, that is so important. You know, the trust that Homer talked about, and why we saw that in action during the rollout of the vaccine. You know, that is so critical.
I'm going to combine, there's two questions into one last question, because it has to do really with, I think, moving next steps forward and accountability. And anyone can jump in here, but how do those of us outside of the Indigenous community hold government and others accountable for not going backwards and actually using this as the new baseline? Accountability is key. Another question is, I'm concerned about bureaucracy and delays in government. How can we replicate the urgency and alignment from your success to get appropriate informed solutions executed in a timely manner?
That's tough. Obviously, that's really tough. Accountability. I mean, right? I don't know how to address that, in the sense that we hear a lot of words and a lot of promises, but it also has to translate into meaningful, sustained impact. And it's easy to talk in high level terms, keeping the pressure on, holding people accountable, but actually operationalizing that is probably, and sadly, a lot more challenging. And, back here on planet Earth, this has been an ongoing issue for a long, long time. And I know Alvin can speak to that much more eloquently than I can. But it's interesting. And, just getting back to what Homer mentioned earlier, perhaps there's growing trust and growing momentum. And also, it's not every day that these issues make their way so prominently in the national media and are discussed with the same degree of intensity among non-Indigenous people, like in places that are distant from Northern Ontario. And maybe I'm being overly optimistic, but this seems to be a growing issue that's appreciated by non-Indigenous communities and other Canadians because of a lot of the attention and momentum that we've seen over the course of the pandemic, that's highlighted a lot of the inequities in care. And I think one of the key issues is not losing that momentum. I'm not entirely sure how, but like any complex issue, I think, pardon the term, multifactorial approaches are the best approach. And that means obviously sustained pressure from local leadership, continued national media coverage, ensuring people of all ages in all parts of the country are aware of the issues that face Indigenous communities. I know it's being taught with increasing frequencies in the schools as well. So there's just growing awareness, and I think that adds to a lot of the help. But truly, getting down to the nuts and bolts of operationalizing accountability is very challenging. I'd love to hear what the others have to say.
We'll hear from Homer and Alvin if you quickly want to add your thoughts on that.
Sure, I'll just say quickly, like as a non-high level policy guy, as someone, I guess, who's sort of boots on the ground is my organization, I think there are a lot of operational problems that we can help solve if we work with Indigenous leadership. And there's a problem of, how do we improve cardiac care, like for an acute heart attack? How do we improve stroke care? There are solutions to this that are operational, that are based on relationships with other hospitals and different healthcare organizations and with the community. I think if we identify targets, timelines, that we can certainly come up with solutions to that. I think sometimes we get bogged down in these large sort of nation level problems, but if we can save 2 people tomorrow with a stroke, 3 people from bleeding the next day, I think we've advanced the ball. And then hopefully when Alvin and his team does the high level work, it's complementary, and it ends up moving the ball forward in all domains, both tactically and strategically.
Thank you. Alvin, we'll quickly wrap it up with you.
Yeah, so just to whoever's listening on this call, the fact that you are here tuning in is important. I always try to end my talks and whenever I'm invited to speak at a forum about what you have learned or what you're learning during this pandemic. You heard about the missing children being found across the country. You probably heard about Joyce Hitchcock, who died at a Montreal hospital while she needed care. The nurses laughed at her, the doctors mocked her, and she died. There's an inquest that happened. You hear about these stories in the media, and it's like the country is finally waking up to what we've been talking about for a long time, and we just need you to stay awake. We need you to be part of the work that we all need to do moving forward, so that we can, not only bridge those gaps, but just the equity that we always talk about in healthcare, especially as it relates to our children. There's going to be a lot of work that we all need to do post-pandemic. We all need to make sure that we have a recovery plan for our children. The toll that this pandemic has taken on our kids, for example, is it's incredible, and that work will be ongoing in the months and years ahead.
Miigwech, thank you so much for this great conversation. We're going to hand it over back to Sal now. Thank you.
Thank you, Willow, Dr. Bogosh, Dr. Tian, and Alvin for sharing your insights, perspective, and knowledge with us today. I appreciated the conversation. I'd now like to take the opportunity to welcome Jean Cabral, Executive Vice President of Billy Bishop Toronto City Airport, to deliver some appreciation remarks. Jean, over to you.
Thank you, Sal. Sal mentioned my name is Jean Cabral, and I am the Executive Vice President at Billy Bishop Toronto City Airport. Billy Bishop Airport is a proud sponsor of today's event and an even prouder base of operations for Orange Medevac services. As I sit here and reflect back in some of the notes from the panel discussion, this powerful panel discussion, it was eye-opening, enlightening on the approach of the issue. Some of the pieces I take away: listening on the local needs, focus on two-way dialogue and coordination, building trust. Do what you say you're going to do from Homer. Alvin identifying cutting through the red tape to build efficiencies and needed on a critical timing issue like these. Powerful statements that we take away from this. As many of you know, Billy Bishop Airport is located on the Toronto Island, just a few kilometers from downtown. and the majority of the hospitals in the Toronto area. This proximity has allowed us the efficient provision of emergency services and organ transfers through our airport, and our teams work together to facilitate this urgent care. As we heard today, during the pandemic, the Orange service at Billy Bishop Airport also spearheaded Operations Remote Immunity to ensure that the northern communities receive timely access to vaccinations in the fight of COVID-19. For reference, Orange flew more than 5,091 emergency flights in 2021. That's an increase over 7% over 2020. As I reflect back to a conversation Homer and I had in March of 2020, when we talked about alignment on making sure that the airport will remain open during the lockdown days of the pandemic. Today, sitting here looking back and realizing the grateful role that we played and the small role that we played in facilitating that for Orange. Another organization that Billy Bishop Airport supports and which operates to and from the facility is Hope Air, an organization that provides flights to remote communities so patients can access Toronto's healthcare facilities. This takes the form of free flights aboard our commercial air carriers and also private pilots who donate their time and aircraft to bring patients to their appointments downtown. One of the key themes today we've been hearing is about keeping the lifeline open between northern communities and the healthcare services they need, which are so often so far away. Orange Medevac and charities like Hope Air have been critical in connecting patients to medical appointments and emergency medical services here in the South. And we at Billy Bishop Airport are proud to do our part in keeping this lifeline open. I'd like to thank our speakers, Dr. Bogosh, Mr. Alvin Fiddler, Dr. Homer Tiam, for sharing your insights and the power and the perspective of the important topic that for us today. And I also would like to thank Willow for your expert moderation of this discussion. I will now turn things back over to Sal for his closing remarks.
Thanks again to Billy Bishop, Toronto City Airport, and all our sponsors for their support. Thank you to our guests and everyone joining today or tuning in later on demand. I'm delighted to announce that our next event will be our first in-person Empire Nights event in 2 years. Join us next week on Thursday, May the 12th, for an evening of networking and learning with our panel of political pundits, the inside scoop on the upcoming 2022 Ontario provincial election. More details and tickets are available at empireclubofcanada.com. As a club of record, all Empire Club of Canada events are available to watch and listen to on demand on our website. The recording of today's event will be available later today, and everyone registered will receive an email with the link. Please feel free to forward it on to your colleagues, family, and friends. Thanks again for joining us today. I wish you all a great afternoon. Take care and stay safe.